Welcome to the City of Manchester Retirees Under 65 Open Enrollment for fiscal year 2022. We want to welcome you to this recording of this webinar for you. We have lots of information for you in this webinar. And Leanna, if you want to go forward, I'm going to go through the agenda.
Sure.
So I'd like to introduce Leanna Delatorre. She's the other presenter on this webinar for you today. She is with USI Insurance Services. They are the city's insurance broker. So we are working together to bring you this presentation. I'm going to start by giving you some open enrollment reminders of what you can and cannot do this time of year. We're going to go over some things with the Anthem Health Insurance, a number of technology tools that are available to you, as well as an overview of the plans. We'll talk about pharmacy. We're going to give you a bit of an education on Smart Shopper. That's the way that you can earn incentive dollars for going to lower cost providers. And then I'm just going to do a brief overview of what happens when you turn 65, what you want to know and what to expect. So we're going to move on to the reminders. So real quick, at open enrollment, even for retirees, this is when you have the opportunity to add or remove your dependents or to enroll or cancel coverage without needing a qualifying event. On the left-hand side of this slide, you can see the list of qualifying events that you would need to have any other time of the year other than during open enrollment in order to make these changes. But now is the time that you can do that. So just remember that. If you are submitting a change form, an Anthem change form, we ask that you please include your primary care physician information. That just helps the claims to process a lot smoother over at Anthem if they can tie it over to your PCP. We're going to ask you to please submit your forms by May 31st and get those to me. My name is Michelle Harrington, and my email is benefitscoordinator@manchesternh.gov. You can get these forms to me a couple of ways. You can scan them with your smartphone or with a scanner and email them to me, or you can actually just take a picture with your smartphone and email them to me that way as well. If you are not making any changes, no forms are necessary. So you can just sit through the rest of the presentation and enjoy the information. Our rates are staying the same this year, so you'll see no rate increases in starting July 1st. That means your pension checks will stay the same, which is good news, and our plans are also staying the same for the upcoming plan year. So we're going to go to the next slide, and we're going to talk a little bit about the health insurance, and I'm going to turn this part over to Leanna.
Thank you, Michelle. So we want to share a new feature for this year. It is called Anthem Health Guide, and what it is it's a new concierge customer service program. So Anthem noticed that there was more of a wait time for City of Manchester employees, and they didn't want you to have to go through with that, right? They want to make sure you can get right through their line. If you have questions on your claims or maybe you can't find your ID card, anything like that, they want to make sure that you can get through the line immediately. So there's going to be shorter wait times. This is a designated phone number for City of Manchester employees. And there'll be seasoned member services reps there on call to answer your phone calls. It's also a more holistic customer service approach, so they can see all your information in the system, right? So maybe you hadn't set up your wellness visit for the year. They're actually going to remind you of that and can actually help set that up with your doctor. So a lot of great new features here. You'll all be receiving a new ID card with the phone number on it. So there'll be a 1833 phone number on the back of your card. And this applies to all of your medical plans. And then we also have the Sydney mobile app. So if you have a smartphone, it's really easy. You can go into the App Store, download the Sydney mobile app, and within that app, it holds all your Anthem information. So you'll be able to see your medical benefits, your pharmacy, you can see your deductibles, how much you've met, out of pocket, etc. It also holds onto your member ID card. We always like to say that people forget their wallets when they go into the doctor, but for some reason they always bring their phones. So if that happens to you, you'll have access to your ID card right there. Lastly, there's a 24/7 nurse line available to you. So this is around the clock staffed registered nurses. So they can direct you whether you should manage your care at home. Maybe you need to make a follow-up appointment at the doctor the next day, urgent care visit, emergency rooms. They're going to help you through all that. And they're there for you to talk through your general health issues 24/7. And then lastly, if you have lower back pain, vascular disease, or a musculoskeletal disorder, you can call a nurse care manager 24 hours a day, 7 days a week. They'll be available to you. And so this program is also backed by a team of pharmacists, dietitians, and exercise specialists. So you'll get help managing your condition and following your doctor's care plan, as well as information that can help you avoid hospital stays and time away. And then lastly, Michelle, do you want to share an update on the fitness reimbursement?
Yeah, definitely. So hopefully some of you retirees have been taking advantage of this. If you are an Anthem member, you are entitled to submit for a reimbursement for your gym membership through Anthem. So it's very easy. If you go onto our website at manchesternh.gov/fitness, it will bring you to the web page. There's a video there that will walk you through the process for submitting your workouts that you're going to track. All you need to do is work out 35 times every 6 months, and you can receive $100 every 6 months, or up to $100 every 6 months. It's really easy. You email those forms over to fitness@exerciserewards.com, put in the subject line, gym reimbursement request, and that will generate the claim and process a check and mail that out to you. So new for this year, thankful to COVID for this, we're now going to include virtual memberships. So if you join some type of membership program online and you're actually paying dues or a membership fee, you can submit for those as well. So that is a new feature this year, and hopefully we'll see some of our retirees taking advantage of this benefit. So we're just going to talk really briefly about the two health plans that are generally offered to our retirees. In addition to these two plans, I just want to reiterate, if you do live permanently outside of the New England area, there are health plans available to you. So if you are on the HMO plan, you are going to be on the out-of-state PPO plan. We do have a few retirees on that. And as well as the high deductible health plan, we have the national plan. So what that does is it puts you into the networks in the areas that you live in. Just remember that your permanent residence must be outside of New England in order to be eligible for these two plans. So for those of you that live here and you're on the HMO plan, just to reiterate, you are on the HMO status service plan. So that means there are 4 services within the HMO plan that can incur additional co-pays if you do not go to a participating site of service location. So those services are outpatient diagnostic imaging, such as x-rays and ultrasounds, your outpatient diagnostic lab services, outpatient high-cost diagnostics, such as diagnostic imaging, such as MRIs, CT scans, and outpatient surgeries. So if you have a situation that you can plan ahead and book out in advance, meaning if this is not an emergency situation, you can select a site of service location and not incur an additional copay. So any site of service location will be covered at 100%. If you have to go to a non-site of service location, you will incur some copays. So for those diagnostic imaging services, it's a $125 copay per scan. Lab services, it's a $50 copay. Outpatient high-cost diagnostic imaging is a $250 copay, and outpatient surgeries are a $250 copay. So let me just give you a quick example for outpatient lab services. If you go to Elliott Hospital or CMC or Dartmouth Hitchcock, you're going to get a $50 copay invoice in the mail from them. But if you go to a place like Quest or LabCorp, there will be no additional copay for that. So that's just an example. If you download the Sydney app that Leanna talked about, you can search for those site of service locations, or you can chat with that new member services representative starting on 7/1 to find those locations. And you can get more information about this on our website at manchesternh.gov/SOS. So real quick about the high deductible health plan. This, the medical plan, as you know, 100% of your preventative care is covered as long as you're going in network. If you're on a single plan, you're going to have a $2,000 annual deductible, and for a two-person or family plan, it's going to be a $4,000 annual deductible. And our annual deductibles run from July through June, and that would include all of your office visits, emergency room care, prescriptions, labs, x-rays, etc. So once you meet those deductibles, all of your traditional health care is paid for at 100% until the end of the plan year, provided it's a service that's covered by the plan. So I know that we have a lot of retirees on this plan. I think you probably have a pretty good understanding of it, but we just wanted to give you a little bit of a refresher on that. So we'll go to the next slide. So what does it cost you? Well, you have your monthly premium deductions that comes right out of your pension check, less any medical subsidy that you're entitled to, and then your deductible based on your level of plan, so $2,000 and $4,000. As you know, there are no co-pays associated with this plan, and once you meet those deductibles, everything covered by the plan is paid for at 100% through June 30th. So next slide. So hopefully many of you stocked up on that health savings account before you retired, and so you have a good chunk of money sitting in there to help you pay for expenses, qualified medical expenses. So we just put together a real quick list here for you. So office visits until you meet your deductible, your Medicare deductibles, and actually once you reach the age of 65, you'll be able to use this for your Medicare premiums. Dental and vision expenses, you can definitely use your HSA money for these things. Just remember that's not going to apply to your deductible. And then you have your prescriptions, hearing aids, hospital, physical therapy bills, durable medical equipment, and in-home nursing care. So these are just some of the things that your health savings account money can be used for. So pharmacy benefits. So what does your plan cover? Well, your plan is going to cover prescriptions is on a national 3-tier drug list. So that includes your brand name drugs and your generic drugs. It's all covered by your benefits. Some of the preventative drugs will be very little cost or no cost to you, depending on where they fall in the tier. And specialty drugs, if you have an ongoing health issue or a serious issue, may cost you a little bit more on that. So if you're on the HMO, you're going to be on a tiered plan, so you will be paying a copay based on the level of the prescription that you're getting. And of course, if you're on the high deductible health plan, you'll be paying full price for these prescriptions until you meet your deductible. Now, if you find that something is not covered by the plan, talk to your doctor or your pharmacist. They might be able to find another drug for you, or they might be able to switch you to a generic or something that's over the counter, and that will save you some money. So again, generic drugs, you can get your 30-day supplies of your drugs that you take regularly, and you can get those delivered to your home. You can refill online or over the phone, and again, that delivery is 90-day delivery is a great feature for you. Just remember, there's about 67,000 pharmacies across the country that you can utilize with our plan. So if you're out of state and you need to, you're on vacation, you forgot your prescription, you can go to CVS and you can pick that up. So we'll go to the next slide. So I'm going to turn this back over to Leanna to talk to you about Smart Shopper.
Yes, so Smart Shopper is a tool that you can use to find affordable and high quality treatment and healthcare. So it helps you to be a more educated consumer, and that's something that we really want to drive home. One point that I really like to make is that just because your doctor or physician tells you you need to get your healthcare done, right? They'll recommend that you have it done somewhere just because they have a relationship, right? And they refer people to those sites. It is your right as a healthcare consumer to question that and to choose where you want to go. So Michelle's example earlier, having blood drawn, going to Elliott Hospital versus Quest, right? That's a perfect example. It is your right to say to your doctor, I want to shop it around, and that's the purpose of Smart Shopper, okay? On the back of your Anthem card, there will be a 1-800 phone number, and that will help you access Smart Shopper. There is a team of individuals that are there to help you, and they will let you know the costs for procedures or tests at different in-network facilities, and they pull that by your zip code, so it'll be nearby. Also, if you choose one of the recommendations made by Smart Shopper, you'll receive a cash reward, and those range anywhere between $25 to $500. Also, one thing to note is that you have the ability to utilize Smart Shopper either by calling the personal assistant team, you can do it by using your mobile phone, or you can just look it up online. So how does it work? All right, so first, your doctor will recommend a procedure on the Smart Shopper list. You shop for your procedure by logging onto the website or calling the personal assistant team, and then you choose the low-cost provider and have your procedure done. So your carrier will in turn process the claim, and the claim is then sent to Smart Shopper. So Smart Shopper will verify that you shopped in advance to having the procedure or labs or anything like that done. So make sure that you do that before your care takes place. Once that happens, once the claim is paid, you will receive your cash reward approximately 60 days from the date of your service. So this is just a nice visual to show how it works. And so one thing we've wanted to point out is now when you are shopping on Smart Shopper, your results will identify if the provider is included in, if it's a site of service location. And so right here, you can see down below in the right-hand corner, there is a little blue box that says site of service care. So that will easily be seen when you pull it up, different than last year. And then this here is just a visual for you to see the differences between going to a low-cost provider versus whoever your physician has referred. Not to say that every time a physician refers you someplace, it's not the most low cost, but this is just a visual for you to see the difference. For example, lab tests. If you had that done at Southern New Hampshire Medical Center, it could be $220. If you went to Quest, it would be $29. Or if it's a site of service, you could actually pay $0 and the city would pay $29 for your claim. Also on top of that, there's a $25 reward. So it really does pay to shop your care. The last listed procedure here, the arthroscopic knee surgery with cartilage repair, if you go all the way down to the bottom, you can see the huge difference here, right? So Elliott Hospital, the cost would be $10,540. By going to an ambulatory surgical center, $4,789. Again, if that's a site of service, you pay $0 and you get $250 in your pocket. So it really does make an impact. And then new for 2021. There is a whole list on the Smart Shopper website of new procedures that are included, and you can find that full list either at their website or at manchesternh.gov/Smart Shopper. You also can now request appointments for mammograms when you call. And again, just to reiterate, you'll now be able to see the site of service location on their website. Also, Michelle is so wonderful about updating the website, and there are some Smart Shopper 101 videos that you can locate there as well. So lastly, I'll turn it back to Michelle to go over retirees turning 65.
Thanks, Leanna. So I just wanted to let you all know what's going to happen shortly before you turn 65. I do get a call from retirees periodically because I know that you are getting bombarded in the mail and on the phone from people trying to provide you with information about Medicare. Just so you know that the city does offer a Medicare supplemental plan, and it's currently a Plan F. So what that means is our plan covers the 20% that Medicare does not cover for Part A and Part B, and the premium includes the Part D prescription. So I just want to let you know that. So information about the supplemental plan can be found on our website at manchesternh.gov/retirees. But you will receive a packet from me in the mail a few months prior to your 65th birthday with information about the plan, information about what it will cost you after your medical subsidy is applied. If you have a spouse or you, the retiree, are still going to be under the age of 65, we're just going to automatically transfer you to a single plan on Anthem. So the same exact plan you have, you'll just be paying a lower rate. You'll be paying the single rate. If you are on the high deductible health plan and you have that HSA, you just need to know that you need to stop contributing to your HSA 6 months prior to enrolling in Medicare. This is an IRS rule. Medicare does look back 6 months, so you want to stop those contributions way ahead of time so that you don't have any issues with the IRS. Just so you know that when you are enrolling on this plan, in order to be eligible, you must enroll in Medicare Part A and Part B. The plan supplements both of these, so you have to be enrolled in both A and B. Part B, there is a cost associated with that. That is paid directly to Medicare through your Social Security check. So when you apply, you can ask them about that, and they will tell you exactly how that works. Age 65 distributions for your HSA, so tax-free and penalty-free, you can use, continue to use that HSA for qualified medical expenses. And you can even use it for your Medicare premiums. That is allowed, not the supplemental plan, but your actual Medicare premiums. And again, just visit our Over 65 webpage at www.manchesternh.gov/retirees. There's tons of information on there, and you can certainly contact me anytime. I'm at Benefits Coordinator at manchesternh.gov, or you can call me at 603-792-6809. So just a reminder, everyone is getting new ID cards this June with that all-important phone number to our new member services concierge service that will be starting on July 1st. So please keep an eye out in your mail for that card. Your ID number will remain the same, but you definitely want to be using the new card so you have that phone number. And if you're tech savvy, great. Download that Sydney app on your phone. That means you're going to have whatever ID card is in effect at that time always with you. So that's a great thing to do. So we're encouraging retirees to join our email list this year so that we can start communicating with you via email rather than sending everything to you through the U.S. mail. So if you would like to do that, there is a link on our website at manchesternh.gov/retirees to set you up on that email list. It's very easy. And if you do join that mailing list, you're going to be entered into a raffle for a gift card. So that raffle will take place on June 30th, and we will notify the winner via the email that you provide us. So thank you all for watching this video. We hope that this was informative for you. If you do have any questions, please do not hesitate to contact me. I'd be happy to talk with you anytime. Thank you very much. Stay safe, and we'll talk to you soon.